is Noah, and I'm going to be your provider today. May I ask who I'm speaking with?
Hi, I'm Alan.
Hi, Alan. Nice to meet you. So what brings you into the office today, Alan?
I'm here for a yearly physical.
A yearly physical, okay. Before we actually get into the physical examination, Alan, there's a series of questions that I'd like to go over with you just to make sure everybody's current and on the same page, basically.
Sure.
Any allergies to report, whether it be to medications or food?
No.
Okay, great. Any medications that you're taking at home, whether it be over the counter or prescription?
I do take a Claritin.
Okay, you take Claritin. And what are you taking the Claritin for, sir?
Seasonal allergies.
Seasonal allergies, okay. And do you happen to know the dosage of the medication of Claritin that you're taking,
It's
sir?
10 milligrams.
10 milligrams? How often are you taking it?
Once a day.
Once a day. Okay, great. Does it work for you, sir?
Yes.
Okay, and when you say you're taking the Claritin for your seasonal allergies, can you describe your symptoms to me? What type of allergic reactions do you have?
Some itchy eyes, sneezing.
Itchy eyes and sneezing, okay. Do you happen to notice that your symptoms are a little worse during a certain time of the day or just seasonal?
It's more seasonal, mostly in the spring when the pollen count's high.
Okay, good to know. It seems like you're taking it appropriately. As far as the severity of your symptoms, on a scale of 0 being, not really irritable to 10 being very, very irritable, what would you rate your allergic symptoms?
About a 3.
A 3 out of 10. Okay, great. Sorry that you have allergies. So moving on, any pertinent medical history, any surgical history that you've had in the past?
No.
Anything, diabetes, seizures, any heart problems that you're aware of?
No.
Okay, great. Tell me about your family. And basically what I'm looking for particularly, sir, is if your siblings have anything, your parents and grandparents, anything pertinent about their medical history, sir.
Well, I'm an only child and my grandparents have passed before I was born.
Okay.
So
I'm so sorry to hear
don't know
about
about them. My dad has high blood pressure and my mom has diabetes though.
Okay, so dad, high blood pressure and mom has diabetes. Okay, we're gonna move into your social history. What's your job occupation, sir?
I'm a plumber.
A plumber, okay. Are you full-time, part-time?
Full-time.
Full-time plumber, okay. Do you smoke, do tobacco products, chew, dip, anything like that?
No.
Do you vape?
No.
Okay, great. Any marijuana use, recreational or not?
No.
How about drugs? Any illicit drugs that you happen to take?
No.
Okay. How about alcohol, sir? Do you drink any alcohol?
Maybe a glass of wine once a month.
Okay, a glass of wine once a month. That's not too terrible. What's your exercise routine like? Do you try to incorporate a regular exercise routine?
One walk with my wife every other day or so.
Oh, okay, going with that. So living situation, you mentioned you have a wife. Any kids at home?
No kids.
No kids? Okay, great. And how long have you been married, sir?
For 3 years.
For 3 years. Okay, great. Just going with that, let's just talk a little bit about your finances. Any issues with access to health care, whether it be prescriptions or not? Any financial issues that you're succumbing to at this time, sir?
No issues.
All right, great. That's good to know. All right, so for the purpose of the video, I would also like to state that I have ensured adequate privacy for the patient, along with lighting. I've also obtained the patient's vital signs prior to this encounter, and at this time everything was normal. Patient's current BMI is 30.4 for a height of 5'8", which leads him into the obese category. As I'm looking at the patient, I see he's in general no acute distress. He seems to be a healthy looking male in his late 30s. So next, what I'm going to go ahead and do, sir, is I'm just going to ask you some questions, just reviewing systems before I actually get detailed. Any problems like headaches that you've had in the past, any head trauma, anything like that?
No.
All right, any vision problems, blurry vision, do you wear corrective lenses?
No, I don't.
All right, great. Any hearing problems, and have you had any issues with balancing, anything wrong with your ears?
No.
All right. How about your nose? Ever had problems with your sense of smell, any injuries to your nose?
No.
Okay. Mouth, are you pretty current with your dentist? Any issues that you've had in the past that, whether it be
Just
dental hygiene?
cavities that have been filled.
Cavities that have been filled. About how long ago did you have that, sir?
4 years ago.
About 4 years ago. Okay, and everything went uncomplicated for that? Okay, good. So how about your skin? Ever have any skin problems in the past? Anything issues with your hair loss or anything like that?
No.
Okay, great. Any heart problems that you have in the past, whether it be chest pain, heart palpitations, anything like that, sir?
No.
Okay, how about breathing problems? Have you ever had any issues with your breathing, where you couldn't catch your breath fully? Okay. How about stomach problems? Ever have, are you having normal bowel movements? Are you able to have a bowel movement daily? Any issues with that in the past before?
No.
No abdominal pain or anything like that?
No.
Okay, great, sir. How about musculoskeletal? Any decreased strength anywhere? Low back pain? Anything like that that you can think of?
No.
Okay. How about psych issues? Any history of depression or increased stress that you felt that you couldn't overcome or anything like that?
No.
All right, great. Well, everything sounds to be in good health for you, sir. So at this point, we're going to go ahead and move into the actual physical examination.
Sounds good.
Okay, so first what we're going to go ahead and do is oh, and I did want to remind you, sir, if during this examination, if you feel any type of discomforts, please do not hesitate to let me know.
Okay.
Okay, so first we're going to move on to skin, hair, and nails. As I'm looking at the patient, I'm noting that, as I look at the patient, I'm just looking at his skin, noting the coloration. It's appropriate to his age and ethnicity. I note that the skin looks nice and smooth, and I'm just kind of palpating, and I see that the hair is evenly distributed on all his extremities and his head. As I was touching his skin, it's nice and smooth, warm to the touch. No excessive dryness is noted. I'm just checking skin turgor. Moisture level seems to be good. Like I said, I don't see any lesions or rashes here. As I'm looking at his skin, I'm just going to kind of go down. I'm looking at his fingers, checking to see if I see any type of clubbing, which I don't. I'm also checking his cap refill, making sure it's less than 3 seconds to ensure for adequate circulation, which it is, and that's good. Okay, sir. So next, what I'm going to go ahead and do is I'm just going to be palpating your head. Just let me know if you feel any type of tenderness.
No.
Okay, great. And as I'm palpating his head, I note that I don't feel any lumps, lesions. I'm noting that his hair is, like I said, evenly distributed. The texture feels clean. It's not overly greasy, and I don't see any foreign bodies in his hair. Next, what I'm going to go ahead and do is I'm just going to palpate back here, just the mastoid process, checking for any tenderness. Any tenderness with that, sir?
No.
Okay, great. And since I'm doing that, next we're going to palpate your TMJ, which is cranial nerve 5. I'm going to ask you, sir, to open and close your mouth for me. Okay, and I didn't feel any abnormal clicks, which is good, so cranial nerve 5 is intact. Okay, so next what I'm going to go ahead and do, sir, is I'm just going to be palpating your sinuses. Just tell me if you feel any pain or tenderness. This is frontal, ethmoid, and maxillary. Any pain or tenderness with that, sir?
No.
Okay, great. So then next what we're going to go ahead and do, sir, is we're going to be testing for cranial nerve 7. So what I'm going to have you do is just stick your tongue out and move up and down, side to side. All right, so cranial nerve 7 is intact. Next, what we're going to go ahead and do is we're just going to be checking your eyes. I'm just going to have you sit here so you're closer to the camera. Okay, so what I'm going to do, sir, is we're going to be testing for cranial nerves 3, 4, and 6. And what I'm going to have you do, sir, is just going to have you follow my pen light, okay? And just keep your head straight and just follow my pen light. Okay, and the patient's doing great with that. Eyes are accommodating and reactive to it. Okay, and there's proper crossing, which is good. And then what I'm going to have you do is look at my pen light and then look behind me. Okay, and eyes were appropriate and accommodating with that, which is good. So then next what I'm going to go ahead and do is I'm going to be looking at the eye. And I would also like to know, as I'm looking at the patient's eyes, you know, they're both in correct positioning. They're very proportional to each other. I'm noting that the eyes, the eyelashes and the eyebrows are proportional to each other and evenly distributed, and they're also in correct positioning as well. Before I shine my light in your eye, I'm just going to go ahead and pull your lids down, just kind of looking. Okay, and as I pulled this lids down, I was noting his sclera, just making sure it's nice, white and shiny, which it was. I'm also noting that the conjunctiva was nice and pink and not overly swollen with no excess discharge noting, so that's good. And his pupils are nice and round and appropriate at this time. So next what I'm going to go ahead and do, and for the purpose of this video, I'd be looking at both eyes, but I'm just going to be focusing on one side at this time. Okay, so what I'm going to have have you do, sir, is just go ahead and look straight, and I'm just going to be looking at your eyes. Okay, and as I'm looking at the patient's eyes, I'm noting that the disc was sharp, retina was in place, and I also saw his red reflex, which is normal, so that is good. Okay, so next, what we're going to go ahead and do is move to the, going on with the mouth, we're going to move to the mouth section. As we're doing the mouth, just go ahead and open your mouth for me, sir. Okay, go ahead and stick your tongue out. All right. And as I looked at the patient's mouth, I noted that his oral mucosa was nice and moist, nice coloration, pink. It didn't look excessive swelling. His uvula was intact in correct anatomical positioning. There was also no signs of swelling or discolorations noted. I would also like to note that when I was looking at the patient's mouth, his dental hygiene does seem to be appropriate. Teeth are aligned and do seem to be clean. So then I also would like to let everybody know that we've elicited the gag reflex, which checks for cranial nerves 10 and 11, and patient does have a positive gag reflex, so those are intact. Patient also does not have any problems with swallowing or speech, which could also be indicative of cranial nerves 10 and 11. Okay, so next what we're going to go ahead and do is I'm just going to look at your neck, okay? And as I'm looking at your neck, I see that it's nice and proportional. It's proportional to your body. As I'm looking at the patient's neck, I'm also checking to see if I see any type of JVD or pulsations, which I don't. That's JVD, jugular vein distension. I don't happen to see that right now. Next, sir, what I'm going to go ahead and do is I'm just going to palpate your lymph nodes, okay? Just let me know if you feel any kind of pain or tenderness as I do this.
No.
All right, great. No pain or tenderness. Then next, what I'm going to go ahead and do is I'm going to test your thyroid. Go ahead and swallow for me, sir. All right, great. Everything was okay with that. Next, what we're going to go ahead and do is we're going to look at your ears, okay? As I'm looking at the patient's ears, I'm noticing that they're in correct anatomical positioning. They're very proportional to each other. As I'm looking at both ears, I'm noting that both ear canals are patent and opened. There doesn't seem to be any issues so far at this time. So now we're going to go into a little bit of a deeper inspection of the ears. So I'm just going to have, and normally I would do this bilaterally as well. So lift the pinna up. And as I'm looking inside the patient's ear, I'm noting that the passage is nice, clear, and open. There's not excessive cerumen buildup or wax. The tympanic membrane's intact, nice, gray, pearly, shiny. And I also saw the cone of light, which is good. So that is great. Next, what we're going to go ahead and do, sir, is we're going to be testing for cranial nerve 8, which is your hearing. We're going to do this by performing the Rhine test and the Warburg test. The Rhine test tests for bone and air conduction. Typically, bone conduction is heard first before air. So I just want you to tell me when you could hear the buzzing sound, okay, sir?
Okay.
And normally this is done on both sides.
Now.
Okay, and?
Now.
Perfect. So that seems to be intact. Next, we're going to move into Warburg's test. What I'm going to go ahead and do is tap this tuning fork, place it on the middle of your head. You just let me know if you hear it more on the left, right, or the middle. Okay?
The middle.
Okay, great. So that's where it should be heard, and it seems to be intact. So next, we're going to move on to the nose. As upon my visual inspection of the nose, I'm seeing it's in correct positioning. It looks good. No excessive swelling noted at this time. So, and like I said, I'd be looking at both passages. I'm just going to focus on the one. So I'm going to just have you tilt your head back. And as I look inside the nose, I'm noting that his nasal passages is nice, clear, and open. It doesn't seem overly inflamed, no type of patches, no excess discharges noted. I would also like to state that I was able to visualize the turbinate and it seemed normal, and his septum does not appear deviated at this time, so that is good. So next, we're gonna move into cardio. Looking at your heart, okay? So first what I'm gonna go ahead and do, sir, is I'm just gonna be palpating for pulses. First, I'm gonna go ahead and palpate, and I would be doing this bilateral. I'm just going to focus on the one side. So I'm going to palpate the carotid pulse here, checking to see, make sure it's very regular, no bounding pulses, and it is. Okay, so I've got carotid right here. Oh, I'm sorry, carotid right here. Okay, then we'll go to, just go ahead and relax your arms there. Brachial, radial. Okay, then I'm you lay down, sir. All right. Then I'm going to palpate for femoral pulse right here. Popliteal. No, just relax here. Popliteal. And then dorsalis pedis. All right, perfect. So next, what I'm going to go ahead and do is I'm going to palpate for PMI, which is point of maximum impulse, sir. What I'm going to have you do is lie to your left side. And as he lies to his left side, I'm just going to go ahead and place my hand. It's going to be very close to where the mitral valve is auscultated. And I'm just pointing or feeling for the PMI. And I'm able to feel it, which is good. Thanks, sir. Okay, so next, we can go ahead and have you come up here and face the camera. So next, what we're going to go ahead and do is we're just going to, I'm going to listen for some heart sounds. And since I'm here, I'm going to be listening for heart sounds, and for the purpose of the video, I just want to let everybody know that typically I would use both the bell and the diaphragm of my stethoscope. Okay, so as I'm listening, I have, there we go. So we have pulmonic, aortic, Arab's point, tricuspid, and mitral valve. And as I'm listening, I'm just making sure there's the normal S1, S2 sounds, making sure there's no gallops and there's no murmurs, and it sounds pretty regular at this time, so that is good. Okay, so next we're gonna go and move into respiratory. As I'm looking at the patient, my first visual inspection, I'm noticing the chest, and I'm looking at the front and side views. I see that there's adequate rise and fall of his chest. There's no use of accessory muscles. He doesn't seem to be any type of distress at this time. His chest is symmetrical in shape. There's no type of barrel chesting, which is good. So next I'm going to go ahead and auscultate 6 spots, and we do this anteriorly and posteriorly. And so I'm just going to expedite it, just have him take a nice deep breath in and out, okay? So normally I listen in, out here, 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 in, out here. I'm going to have you turn around for the camera. Okay, and same thing. In, out here, 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 and in, out here. Okay, great. So next what we're going to go ahead and do is we're going to test for respiratory excursion. How I do this, I'm going to place my hands right here. And what I'm going to do is ask the patient to take a nice deep breath in and then blow it out. Okay, and there's adequate chest wall and rise and expansion, which is good. Next, we're going to do diaphragm excursion. So what I'm going to have you do, sir, is take a nice deep breath and hold it. Okay. All right, go ahead and exhale, and then go ahead and hold that. So it's about right here. So I measured, okay, you can breathe normally now, sir. So I measured about 4 centimeters in between. As long as it's within the 3 to 5 centimeters, we are within range for the diaphragm excursion, so that's normal. So that's good. So next, what we're gonna go ahead and do is I'm gonna be assessing for vibration by doing tactile fremitus. So what I'm gonna have you do, sir, is repeat the word 99 as I place my hands in 4 periodical spots, okay? Go ahead,
99, 99, 99, 99.
Perfect. And I felt adequate vibrations on both sides, which is good. Next, I'm going to be testing for is CVA tenderness, that's costovertebral angle. So, sir, what I'm going to do is I'm going to place my hands here. You just let me know if you feel any type of pain or tenderness as I palpate. Any pain or tenderness felt?
No.
Okay, same thing here. Pain or tenderness?
No.
Okay, great. If he was positive, it could indicate inflammation to the kidneys or maybe possible stones, and he was negative for that, so that is good. Okay, sir, so we'll have you turn around. Okay, so next what we're going to go ahead and do is we're going to move into the abdomen part. So I'm going to have you do is just lay onto your back. All right, we're just going to bring this up, and upon my visual inspection of the patient's abdomen, I noticed that the color is good. It's appropriate to the patient's age and ethnicity. He's not using his abdominal muscles that are showing me that he's having trouble breathing. There's adequate rise and fall. I'm also noting that I don't see any type of abdominal distension at this time. I see that the hair is evenly distributed. I don't see excessive striae or lesions or any type of herniations on the stomach at this time right now. So next, what I'm going to go ahead and do, sir, is I'm just going to be listening to your bowel sounds. Okay, I'm going to start off with the right quadrant. Listen to 4, and typically I would listen for about 1 to 2 minutes. And as I'm listening to these quadrants, I'm just making sure that his bowel sounds are nice and normal, and they do sound nice and normal at this time. Patient also reported that he has no issues with his bowel movement, which is good. Okay, and since I have this on, I'm going to go ahead and check for bruits just to see if I can hear any type of bruits. So we're going to go for aorta here, renal, iliac, and femoral, just listening if I hear any type of bruits, and I don't, and normally that would be done bilateral. I didn't hear any type of bruits there. So the next one I'm going to go ahead and do is I'm going to be doing some light palpation, see if there's any type of tenderness felt from the patient. Just let me know if you feel any type of discomfort. Starting with the right quadrant first. Or actually, I'd like to percuss first. So let me know if you feel any type of pain or tenderness while I percuss first.
Okay.
Tenderness?
Nothing.
Okay, next I'm in light palpation. Any pain or tenderness there, sir?
No.
Okay. Now I'm going to go into a deeper palpation. Pain or tenderness?
No.
All right. Tenderness?
No. No.
All right, great. And so next what I'm going to go ahead and do is we're going to palpate for Murphy's sign. So what I have you do is take a nice deep breath in and exhale it out completely. And as he exhales it out, I'm just going to go underneath and feel if I can palpate that gallbladder. And that's good. No tenderness there. Okay, go ahead and breathe normal. And same thing now, I'm going to try and palpate for the liver. So same method, I'm going to take a deep breath in, exhale it completely. And as we exhale, I'm just kind of palpating this right side, just making sure I can feel the liver, checking to see if it feels enlarged, and it doesn't. Okay, and then next what I'm going to do is I'm going to palpate for the kidneys. Normally this would be done bilateral. I'm going to focus on one side, have my hands right on one underneath here, one right around his flank. On the top, I'm going to have you take a deep breath in and exhale it completely out. And as he exhales it out, I'm feeling his kidney, which is good. Okay, great. So next, what we're going to go ahead and do is we're going to test for the obturator sign. So what I'm going to do there is I'm going to take your right foot and bend it. And as I bend it, go ahead and turn it inward. See if you feel any kind of pain with that. Any pain with that?
No.
Okay, great. Next, we're going to go ahead and do the psoas sign. So I'm going to put some resistance here. Just go ahead and lift your right knee and see if you feel any pain or tenderness to that right lower quadrant.
No.
Okay, great. So he is negative for the psoas sign. Okay. All done with the abdomen. So go ahead and have you sit up again, sir. Okay, as you're facing the camera here, what we're going to go ahead and do is we're going to move into musculoskeletal now. So what I'm going to have you do, sir, is I'm going to have you go ahead and just stick your hands out for me, up, down. Okay, do some ulnar radial deviations. Any pain with that? Go ahead and bend your arms for me. I'm going to put some resistance, pull back. Okay, great. And then if you want to grab my hands, just go ahead and squeeze them, testing for equal hand grips, which is good. That is good. Okay, and then I'm going to go ahead and test your shoulders. I'm going to put some resistance down and lift up. Okay, and to pledge allegiance, both sides. Okay, and then you could do the Apley scratch test, both sides. Okay, and I'm noting that he has even distribution on both sides for the Apley. Okay, and then if you can do the, put your arms out and just pretend like you're emptying a can. Any pain or issues with that?
No.
Okay, great. And then let's go ahead and and I would do this normally on both sides, but I'm gonna focus on the one. I'm just gonna relax your arm for me, sir. But what I'm gonna go ahead and do is when I release, just go ahead and try to hold your arm up. Okay, and just making sure your shoulder is intact. Okay, that is intact, which is good. Okay, so next, what we're gonna go ahead and do is we're gonna be doing his range of motions to his lower extremities. So first, what we're gonna do is I'm just gonna put resistance down. Just lift up. Okay, same thing here. Lift up. Great. And then if you can take your feet, move up. Great. Push down. All right. Great. Equal and bilateral, which is good. So next, what I'm gonna have you do, sir, is I'm gonna have you lay down, and I'm gonna be checking your knees. Okay, so the first test, what we're gonna go ahead and do, it's the McMurray's test. It would be done on both legs. I'm gonna go ahead and use this side. And so what I'm gonna go ahead and do is I'm just checking for any type of abnormal clicks as I go up. Just kind of feeling, making sure I don't feel any type of abnormal clicks. And I'm going, I'm bending. Any pain with that, sir?
No.
Okay. All right. Great. And go ahead and bend your knee for me. Just testing, making sure. Any pain? Oh,
No.
normally I'd have to sit on the. Any pain or tenderness with that, sir?
No.
All right. I don't feel any abnormal clicks, which is good. And then we're going to go ahead and now we're going to go ahead and do the apprehension test. Go ahead and relax. And normally this would be done on both sides. So I'm just going to take, and I'm just testing the range of motion of your shoulder. So what I'm going to do is have you kind of come out, bend his arm up. And as I bend it, I'm just going to kind of go back a little bit. Any pain with that, sir?
No.
All right. Right, and that would be done bilaterally typically. Okay, so go ahead and get up, sir. Okay, and just face camera. All right, so then next what we're gonna go ahead and do, sir, is we're gonna be testing your sensation, just letting me know if you can feel light and sharp. Okay, so this is gonna be the sharp feeling.
Okay.
This one's gonna be the dull.
Okay.
Okay, so what I'm gonna have you do, sir, is close your eyes and tell me if you feel sharp or dull pain. Okay?
Okay. Sharp. Dull. Dull. Sharp. Sharp. Dull.
Okay, good. You can open your eyes now, sir. You did really well with that. Okay. And so next, we're going to be testing for vibrations. And we're going to do this like I checked both sides. I'm going to focus on the one. Just let me know if you can feel the vibration, sir, okay? Bony prominence here.
Yes.
Okay. And then I'm going to be doing on the greater toe. Bony
Yes.
prominence there. Okay, great. So then, next, we're going to be checking for reflexes. Okay. Oh, and one thing I think I forgot to mention is I didn't listen for carotid bruit. So let me do that before I start doing reflexes. And I don't hear any type of carotid bruise. All right, so moving on to reflexes. So what I'm gonna go ahead and do is we're gonna start off with the reflexes. We're gonna go ahead and do your biceps. Okay, so just go ahead and relax your arm here.
Oh, excuse me. It smells like peppermint in here.
Okay, so go ahead and put your arms like that. Okay, great. I'm just testing the reflex. Okay, great. Then I'm going to do brachioradialis. Here. Just relax your arm. Okay, a little there. And then I'm going to do tricep. Just go ahead and relax your arm for me, sir. All right, great. And then we're going to move on to patellar. So if you can sit back just a little bit, sir. Okay. Great. And then we're going to do Achilles. Great. And then next what we're going to be testing for is the Babinski and plantar reflex. Seeing if the toes fan out, which they don't. And normally that would be done on both sides. So next, after the reflexes, we're going to go ahead and we're going to work on some cerebellar functions. So let's go ahead and do finger to your nose. Problems with that? No? Okay. If you can do rapid hand movements onto your knees, any issues with that?
No.
All right, great. So then I'm going to have you stand up, sir. Okay. And as you stand, I'm looking at the camera. I'm just trying to note your spine alignment. It seems like it's appropriate. Your posture is really good. No issues with that. And as the patient's standing, go ahead and stand this way, sir. Go ahead and close your eyes. And I'm just doing the Romberg sign. See if I'm seeing any type of swaying, any type of balancing issues, which I don't see at this time. So you can go ahead and open your eyes. That's good. So next what I'm going to go have you do, sir, is just do the shin to your heel on both sides. Okay, no issues there. And go ahead and bend your knees. We're just making sure that you've got good range of motion there. No problems with that, sir?
No.
Okay, great. And then if you could, I'm just going to test your spine alignment. If you could just do range of motion side to side. Any problems with that, sir?
No.
All right, great. So then next, what we're going to go ahead and do is, before I have you do the gait on the nasal part, I forgot to check for olfactory 1, which is, or olfactory, which is cranial nerve 1. So what I'm going to have the patient do is, if you can sit down just for 1 second,
Sure.
just let me know what you smell with this. And oh, go ahead and close one nose for me. And then just let me know if you smell that.
Smells like mint.
Okay, great. And normally that would be done on both sides as well. Okay. So last one I'm going to have you do is go ahead and stand up, sir, and we're just going to watch your gait. So what I'm going to have you do, and I think I'm going to have to take the camera here, move it down a little bit. So go ahead and walk normal for me, sir. Okay, and when you walk back on your heels, sir. Okay, and now when you walk back, walk on your tippy toes. Right, great. And then when you walk back, I'm going to have you tandem, heel toe, heel toe. All right. That seems to be adequate with that. Okay. So this concludes the end of our examination. If at any time you need to come see us anytime sooner, right now I'm giving you a clean bill of health. Everything seems to be appropriate for your age. If you need to see us, come anytime. Or if you need to see us, come see us anytime, and just enjoy your day. Have a good day.
Okay, thank you.
Thank you.